campaign on stopping smoking. It's the new year. It's time to make resolutions. It's time for all of us to resolve that we're going to live healthier lives. We're going to get more exercise. We're going to make sure that we eat fruits and vegetables. And probably the single most important thing as a community that we can do to improve our health.
Oh, wow.
Thank you, Supervisor. The single most important thing that we can do to improve our community's health is to stop smoking. It is still the #1 cause of preventable death in the United States, smoking. It's also a cause of tremendous disability and loss of function among our San Francisco residents. So I'm incredibly happy to partner with the American Lung Association, with Pfizer, for this great campaign. Very straightforward. Make today the day. Ask your doctor, that's me, about the ways to quit smoking. Whenever I have a patient in my examination room who is a smoker, I ask them, are you interested in stopping? And what would it take you to stop? And then with that patient, I review the various options, of which there are several. There are quit lines, there are patches, there are medications that you take by mouth, all to help create a package that would enable someone to stop smoking. With that, and with great pleasure, I would like to introduce Supervisor Eric Mar, who is my own supervisor in the Inner Richmond District, and more importantly, has been a really leading advocate for making San Francisco a more healthy city in a number of ways, including decreasing smoking. Supervisor Mar.
Thank you. We have the most awesome public health director in Dr. Mitch Katz in the city of San Francisco, also one of the healthiest kind of people in City Hall too. Let me first share a personal story. As I was growing up kind of as a child, my mother and father both smoked like crazy, especially around us as children. And out of love for her and concern, my twin brother and I used to go around hiding her packs of cigarettes, but also when she wasn't looking, breaking her cigarettes in half so she couldn't smoke. And it wasn't out of concern for our own health, but it was more because we loved her and wanted her to live as long as possible. But now, kind of with what we know from studies by many different health departments and universities, that secondhand smoke is one of the major problems as well. But not only is quitting smoking one of the most important things that a person who smokes can do to improve their own health, but smoking also imposes a tremendous burden on the economic burden on our city. And as a supervisor, we will see that very clearly as we deal with the budget crisis coming up. That's why I feel so strongly about increasing smoke-free environments throughout the city, and having fewer accessible places to smoke motivates smokers to smoke less and hopefully ultimately quit. It also provides further protections from secondhand smoke, which is a known carcinogen and causes death of approximately 6,000 people in California annually. And the San Francisco Tobacco Free Project and the coalition that we've been working with are really great educators of the community on those issues. Approximately 14% of all adults in San Francisco smoke. That's about 1 in 7 people. Reducing or eliminating public smoking altogether is one of my top priorities in helping to create a healthier San Francisco with Dr. Katz and others in the city. But smoke-free public spaces is only part of the equation. Encouraging smokers to consult their doctors, and by providing smokers access to proven treatments and help tools, greatly increases the likelihood of quit success. And I'm really proud also that the American Lung Association and the city have really culturally sensitive materials too, and are working with many different ethnic communities and culturally different communities to have different ways to outreach to them in sensitive ways as well. And that's why this public health campaign is so important. We want to help increase the likelihood of quit success in all of our neighborhoods in San Francisco. Now it's my pleasure to introduce Dr. Jim Brown, a volunteer with the American Lung Association in California and a professor of medicine, pulmonary and critical care medicine at UCSF and the Veterans Affairs Medical Center in San Francisco. Dr. Brown.